The first part of the question from Honorable Basaris is to explain the criteria used to prioritize settlement of NHIF claims to eligible hospitals and reasons why certain facilities are paid fully while others are not. Chair and honorable members, during the period under review, the repealed NHIF Act of 1998, which was revised in 2022, was in force. Clause 22, Part 1 of the Act states that the board shall pay from the fund benefits to declared hospitals for expenses incurred at those hospitals by any contributor, his named spouse, child, or other named dependents. The Act was repealed, of course, on 19th October 2023. Currently, NHIF claims reimburses claims based on availability of funds received from statutory deductions from the formal sector, revenues from the informal sector, government remittances for sponsored programs and enhanced schemes and premiums. Reimbursement of claims to hospitals is therefore fully dependent on the availability of funds. Nevertheless, NHIF has continued to ensure a good balance in payouts to government, faith-based, and private healthcare providers. Chair and honorable members, between October and December 2023, the payout ratios are summarized in a document that I have provided there. That is what was paid to government facilities, what was paid to faith-based facilities, and what was paid to private facilities. That is summarized in the table that I have indicated. While government facilities providers account for 66.7% of the total number of providers and 22.03% of total number of transactions, 17.95% of the total payouts made in the first and second quarter of the financial year were made to Government of Kenya facilities as indicated in the table above. In the third quarter of the financial year 2023-2024, a total of 1.8 billion shillings, 1.8 billion, and Kenya shillings 653 million and 363 million was paid to national, the county government, and faith-based facilities respectively. That is to mean the national was 1.8 million, the county government 653 million, and 360 million to faith-based facilities. In addition, in the month of February 2024, 238 million was paid out to national and county government facilities out of the and out of this payment, 321 million was paid for Linda Mama. In Nairobi County, payments made to the 3 national referral hospitals, that is Kenyatta National Hospital, the Kenyatta University Teaching, Training and Referral Hospital, Mathare Mental Hospital, in the current financial year totals to 2.9 billion. Nairobi County facilities have also received a total of 326 million in the current financial year. The total amount paid to all Nairobi County facilities this financial year, therefore, stands at 3,575,411. The next question, Chair and honorable members, to explain why there are delays in payments of monies owed to NHIF, owed to some hospitals, particularly the Kenyatta National Hospital and the Nairobi County facilities for services already rendered. Chair and honorable members, late remittance of NHIF deductions by the formal sector employers. Some enhanced schemes premiums have also not been remitted to NHIF in the required time frame, and the informal sector remittance is also low because of the Repeal Act allowing beneficiaries to purchase health insurance voluntarily. Chair and honorable members, I would like to mention that I have spent 2 hours this morning with the Treasury, and the discussion was around the amounts that need to flow to the Ministry of Health, one of them being to NHIF. A total of 29 billion is outstanding that we have not received from the Exchequer. Some of that from the ministries that we have already provided service, like the National Police Service. We haven't been paid those premiums yet services were already provided. And some for the government programs like Linda Mama, the one on the vulnerable and older persons, the persons of disability, indigents. Equally, we have not received those premiums. Those are outstanding. Nevertheless, services were already provided. So in my morning meeting with the Treasury, with the Cabinet Secretary for Treasury and the Principal Secretary, we have agreed on how the payments should flow, and he has assured me this week that by end of next week we'll get some amount. We have agreed on staggered payments so that we can be able also to meet our obligations. So on question 3, outline the plans, if any, that the government has put in place to cushion detained patients with outstanding bills beyond NHIF settlement through waivers of bills, including a possible framework for waiver by both county and national hospital. The country does not have an overarching framework for waivers in place. However, national hospitals have developed mechanism of addressing patients who cannot pay upon discharge. For example, Kenyatta National Hospital has developed a policy on credit system where patients and the hospital develop payment plan and commitment to pay over a period of time. Despite this, there are several patients who do not honor their commitment. The hospital has a credit committee that then evaluates the patients and develops the payment plan with the patient. And I would like to add that there's even the social side of Kenyatta National Hospital that then evaluates and sees those who won't pay, can't pay for whatever reason, and there are waivers. But that is something not to be encouraged, of course. In Mathare Teaching and Referral Hospital, some categories of patients are exempted, including prisoners and people who are remanded. The hospital also has a waiver committee that evaluates the patients who cannot pay or are even abandoned by relatives and waive the amount, which is then reported to Treasury. The process is also similar in the counties, where waiver guidelines are developed by county treasuries and waiver committees evaluate patients on case-by-case basis. However, the counties can provide more details on this, and specifically for Nairobi County, then they can provide more details. It is important to note that the waivers or commitments that are not honored results in huge financial loss to the hospitals, affecting the ability of the hospitals to ensure quality services are delivered. With operationalization of the Social Health Authority, every Kenyan is expected to be a registered member of the Social Health Authority. The people who can pay will pay for themselves, while the government pays for the ones who cannot, those who have been identified as indigents. Then the government has undertaken to pay for those. I therefore expect cases of detention of patients due to non-payment to significantly reduce, as hospitals will be reimbursed for services offered. And Chair and Honorable Members, under the Social Health Authority, we have a robust digital system that we are going to implement within the Social Health Authority, so that even the losses that we have experienced before, we can be able to take care and ensure that we optimize the use of resources received through Social Health Authority. Question 4, give timelines in which the government is planning to release approximately 32 billion owed by the government to all NHIF accredited government and private hospitals, including 480 million owed to the Nairobi County medical facilities and 1.6 billion owed to the Kenyatta National Hospital, and provide a report on all accruals and payments made to health facilities for the year 2021, 2022, and 2023. Chair and Honorable Members, the Ministry of Health has engaged the relevant government agencies that owe NHIF to pay up their debts, as to enable NHIF meet its obligations to healthcare service providers. We have attached an annex, is a schedule of debts that are owed to NHIF by government agencies, and Annex 3 is claims payment made to Nairobi County health facilities. And Chair and Honorable Members, I think this speaks to the bigger question of what I was doing this morning with the Cabinet Secretary for Treasury. The Honorable Member has requested that I give timelines. Unfortunately, from where I sit, I cannot give timelines unless Treasury has given a commitment, which, as at this morning, they have asked me to wait for next week based on what we have agreed on. so that then they can disburse in some form of some amount. Actually, the agreement this morning is that at least we get a minimum of 2 billion next week to be able to meet our commitments. But however, you can see the need is huge. The resources are not available. So we are in a catch-22 situation. But I'm happy to report, Chair, that with the reforms that we have brought in terms of financing healthcare through the Social Health Insurance Fund, our projection is that we should be able to meet the obligations under healthcare if we are able to raise those resources. But most importantly, Chair and honorable members, as a country, we also have to get into the culture of paying for our social health insurance, because we will have the law, we'll have registered people. We have said it is mandatory, but if people do not pay, then we do not raise resources for healthcare. They are the same people who will come around and ask for waivers. So really, we have to agree and see how best we move forward in terms of enforcing payment for social health insurance. The last question 4, outline measures the government is putting in place to ensure that no person is denied emergency medical treatment regardless of NHIF approval. Chair and honorable members, Section 28 of the Social Health Insurance Act provides for the establishment of the Emergency, Chronic and Critical Illness Fund, which under subsection 28B of the Act will cover the costs of emergency treatment for all Kenyans regardless of prior approval from the authority. Chair and honorable members, I would really want to emphasize on the need for enforcement of payment for social health insurance that the government has already undertaken, that whoever is not able to pay, whoever has been classified as an indigent, the government is going to pay for them. Therefore, those with capacity to pay ought to pay for their insurance. And that is the only way that we are going to raise resources to take care of healthcare. And that includes resources for health workers, includes resources for interns. Chair and honorable members, I submit.
More radio, 88.2 FM. We are in charge.